When an osteoporotic fracture occurs, the person immediately experiences some degree of disability and pain, and certainly surgical repair of fractures helps gain back the ability to use the affected bone or joint, but sometimes there is long-term disability associated with certain types of fractures, for example, wrist fractures. Backbone fractures and hip fractures, on the other hand, tend to have more serious implications because the person actually has an increased risk of dying after having a backbone or hip fracture to some degree. Hip fractures are the greatest concern because of the chance that that person might have difficulty walking after the fracture and might be somewhat immobilized or even sometimes bedbound or wheelchair bound as a result of the hip fracture. So implications of having an osteoporotic fracture, it's not just the pain, it's not just the height loss if it's a vertebral fracture, but it's also the immobility and the limitations on what the person can do after a fracture has occurred. Once a fracture has occurred, it's important to realize that in the next 18 months or so, further fractures may also occur without much effort, and so there is an increased risk of subsequent fractures once a fracture has occurred. So we caution our patients to be careful with physical activities and other activities that might lead to falls after a fracture so that there will not be a subsequent fracture in the next 12 to 18 months. Other implications of fractures are difficulties doing normal daily activities and things that that patients will have to do to maintain independent living. These can be impaired because of the changes in the skeletal architecture or in the strength or the symptoms that the patient will have. And one of the biggest limiting factors for many of our patients after backbone fractures is chronic back pain that doesn't seem to get better. This affects then their ability to lift, to twist, to turn, to reach overhead, many things that are required for daily independent living. The other types of fractures, most often after a period of time, will get better to the point that full mobility and recovery of function is obtained. And so in general, the biggest concern about fractures is the immediate pain, the short-term disability, and the possible increased risk of dying after certain types of fracture.